What conditions can urodynamics diagnose in patients? Have you ever wondered how doctors figure out what's going on with your bladder? Urodynamics is a series of tests that help evaluate how well your bladder, sphincters, and urethra store and releases urine. These tests are crucial for diagnosing various bladder health issues, including conditions that might affect bladder function. Urodynamic testing looks at several important aspects of bladder function. It measures bladder pressure, capacity, and how well the bladder and urethra work together during filling and emptying. The results from these tests help healthcare providers pinpoint specific problems that may be causing urinary symptoms. One common condition diagnosed through urodynamics is overactive bladder. This occurs when the bladder contracts involuntarily, leading to urgency, frequency, and sometimes incontinence. Urodynamics can confirm if this is happening. Another condition is urinary incontinence. This can be due to stress, which means leakage occurs when you cough or sneeze. It can also be due to urge incontinence, where there is a sudden strong need to urinate. Urodynamics helps determine which type of incontinence is present. Bladder outlet obstruction is another issue that can be detected through these tests. This condition involves blockages at the bladder neck or urethra, often caused by an enlarged prostate, strictures, or tumors. Identifying these blockages is vital for bladder health. For patients with neurological conditions like multiple sclerosis, spinal cord injury, or diabetes, urodynamics can assess how nerve damage affects bladder control. This is known as neurogenic bladder. Urodynamics can also help diagnose interstitial cystitis or bladder pain syndrome. These tests can reveal hypersensitivity or pain during bladder filling, as well as reduced bladder capacity. Sometimes the bladder does not empty properly, leading to distension or retention. Urodynamics can identify these issues, which may stem from obstructions, nerve problems, or certain medications. Additionally, for patients who have had surgeries or have anatomical abnormalities, urodynamics is crucial for evaluating bladder and urethral function. While urodynamics is not typically used for initial bladder cancer diagnosis, it can be important for assessing bladder function before or after treatment. For example, after tumor removal, these tests can help determine if the bladder is functioning normally or if further intervention is needed. In summary, urodynamics can diagnose a range of bladder health conditions, from overactive bladder and incontinence to obstruction and neurogenic bladder. Although it is not the primary tool for detecting bladder cancer, it plays a valuable role in managing bladder function related to cancer treatment. Always consult a healthcare provider for personalized advice and to interpret urodynamic results accurately.